You're welcome back to the Chronicles of a Ghanaian Diaspora Nurse. Thank you for tuning in once again. And today I'm so excited to have a colleague who is actually doing something to support healthcare in Ghana. So I'm just gonna bring him on, and we're going to have a discussion about his experiences and what he's doing and what we can learn from it, and what support we can give to him. So, Mr. Akonnor-Fianko, welcome. Thank you so much for honoring this invitation. Thank you.
Thank you very much for having me.
Okay. So first of all, I would like, I've already mentioned your name, but I'd like you to tell us about a bit about yourself, your current role, and where you work, and how long you've been in the UK for, and yeah.
Right. Thank you very much. My full name is Ebenezer Akonnor-Fianko, but I prefer to be called Akonnor-Fianko. I migrated from Ghana in 2004, and I've been in the UK since 2004. My first job was with Oxford Health, NHS Foundation Trust in Oxford, and I have stayed with them to date. I've managed to rise from being a band 4 staff nurse or newly qualified from Ghana to a band 7 now. And my current role is patient flow and referral manager for the forensic services. My practice in the UK has always been with the forensic services, which I'm really passionate about it. Yeah, so that is me, and that's what I've been doing in the UK.
Thank you so much. So I didn't even realize that you were trained abroad. I thought you were trained here.
I was actually trained in Ghana, yes.
Okay, wow. So how was your experience like transitioning to here to work in the UK?
Yes, it was a bit different, I should say. I qualified in 2000 and practiced in Ghana for 4 years and moved to the UK. And reaching the UK, I realized that there's a quite different in terms of our practices and what we do here in Ghana and what we do here. Learning opportunities or learning was basically similar. What we learned in Ghana was more similar to here in terms of patient care and everything. So in a sense, the practice is quite slightly different from the way we do things. It's slightly different.
True. Yeah.
But I had a very good support system when I came in. So the integration was quite smooth.
Okay. That's really interesting because I mean, like as I was saying in my other video, like, when you talk about the diaspora healthcare professional, we come in different categories. We've got people like yourself who've, worked back home and then transitioning here to work. And we've got people too who come here for different reasons. Like for myself, I came, even though I was working in the healthcare sector in Ghana, I was doing a different thing in health education, health promotion. Came here to do a course and then decided to do mental health nursing, and then found myself in. So it's interesting to see the different routes that people come through and end up working in the health sector here. So what would you say has been your best achievement in your nursing career since you've been here?
Well, it's quite a lot of experiences, but I think the one that I can mention is, coming from Ghana here, as soon as I got here, I was start thinking about the practice here is different as compared to how things have been done in Ghana. And my main focus is to pick up, learn some few things and the best practices and go to Ghana and share with my colleagues who are there to see improvement, because the ultimate goal is making a difference in patients' life. So that was my main reason why this, and the achievement that I have made is in that line. I've been able to establish a charity in Ghana, and I've been working with the 3 psychiatric hospitals in Ghana since 2009. Although it has been a bumpy journey, but I think that I've made some significant impacts with the services over there, especially at the psychiatric hospital.
Yeah, bumpy indeed. I think we'll talk about more of that when we talk in detail about your project. I can certainly identify with the bumpiness. Haven't had the experience of, going back and forth since 2006, doing training, skills share here and there. There are certainly bumps in the road, so we'll get to that. But can I just ask you, what inspired you to give back to Ghana? Because as we know, sometimes people, the kind of hardship or the working conditions that people are in, that it's so hard that when people get out, it's like, oh, I'm relieved, I'm in a better place. And having spoken to different people as I started this journey of going back, and there are people who actually don't want anything to do, they don't even want to hear going back. So what inspired you? What inspired you to think about, going back and doing all these things in spite of all the problems, challenges?
Yeah. My inspiration actually came from a gentleman, I think he is currently the Human Resource Director for the Ghana Health Service, called Dr. Sabre. Okay. He wrote, I think during his thesis, during his PhD, I think he wrote a thesis on brain gain, because at the time, there were a lot of people moving from Ghana and a lot of African countries, and there was this issue about brain drain. And he made a very good analysis about the positive of people migrating to developed countries. And part of it was to, kind of make it known that people, wherever we come here, we learn. And then, so at some point in terms of our migration, it becomes, we look at the brain drain, but at some stage, it might tend, the brain drain may be a positive impact in the country that we migrated from as a brain gain. Yeah. So being back to share your experiences with people who are based in Ghana and practicing, for instance, is a form of brain gain. So at some point we lost, at some point we gain. So that's actually something that I read about it, and I got motivated to say, okay, fine, there's opportunity for something to share back. It would be good for me to do that. And then also, when I was in Ghana practicing, I found that there are things that we can do differently in terms of, I remember when I was working on one ward and the water flow once in a week or so, and water was very important in terms of making sure that the environment and patients are. So I managed to speak to somebody, and the person gave me a water pumping machine. So what we do is that I gave it to the ward, and when the water flows, we managed to pump it to get more enough pressure to store some of the water. And I found it very useful. So it's actually on the background. So anything that I can do to make a difference has always been my drive.
Yeah. Thank you so much. Thank you so much for that. It's so true that, the brain drain turning it into brain gain. Certainly true. So now tell us about your project and how long have you been doing it?
Yeah. As I mentioned it earlier on, I started this journey of going back to Ghana in 2009. I went there, and in fact, during my, between 2006, I was going to Ghana on a visit. So I went to one of the wards and I found a BNF that they were using, and the BNF was, I think, 1992. Wow. That was around 2006. And I realized that on my ward, we have about, we do it twice in a year.
Yeah.
It goes to recycling. So I sent a email and I managed to package. I got a lot of it. So the pharmacy were sending it back to my ward. So in 2009, I just packed them and sent it to Ghana. And then I went to the hospital to share, to give to the hospital to put the current one in each ward. And then also I just, that was when I started getting in touch with them. And then one of the good things that we do in terrorism forensic services is incident review. Mm-hmm. So ask one of the nurses in charge whether they have any system of reviewing their incidents, because when you review incident, you learn from it, and then they said no, they don't have anything like that. So when I came back, I prepared like a workshop, a training session, and I went back in 2009 and I met all the ward in charges, and then we did a bit of a workshop. Some of it was around risk assessment and management, and then reviewing of incident and learning from incident. And the session was well received. So that also motivated me to going back and then doing it. Yeah. So from my initial training session was at Pantine. Then I moved to Accra Psychiatric Hospital, but then Dr. Osei was in charge there. He welcomed me to do that. And then I moved to Anchor. So I had this sort of training session with all of them. And then I once was called by he's currently the head of the I think the registrar at the Ghana Midwifery Council. Okay. And then he was, because the mode of training, I think he heard about what I've been doing, and then we spoke about it and told me that next time when I come to Ghana, I need to come and seek, because I'm engaging nurses, I need to come to the NMP to get clarification. Okay. And I told him that I'm registered nurse, so I still keep my registration in Ghana is still up to date. Yeah. So as I speak, so I was motivated to keep my registration, and that was my defense. And so I managed to say, okay, fine, if you are a nurse, qualified nurse in Ghana, you can share your knowledge, that's fine. But if you don't have up-to-date registration, then you need to come and get clarification from us. So that was what happened. So I was doing this workshops up to 2015. Then I realized that anytime I go back, whatever we plan to do is not actually being practiced,
implemented. Yeah.
So yeah, then and in the process, I got myself involved with some patient activities in the Oxford, where we used to have league. Okay. So we were playing football league in between wards, and I saw how the patients were engaging. Mm. So in 2015, when I went to do the workshop, I told them that we are moving from engaging the staff into engaging the patient. Okay. So we the plan to use football or sports as a tool. Okay. To improve patient care and then kind of motivate patients towards their recovery. Okay. So when I came back, we needed money to buy the equipment and football items to give into the hospital to them. So it was a challenge because there was no funding coming in, and you write to people, you don't get any good response. So I took upon myself, I'm sharing about my journey, I put upon myself that, okay, every Sunday, if I don't go to church and I go to work, half of the earnings because it's extra shift.
Extra, yeah.
It goes into what I wanted to do. So I got myself involved. Basically, I was pretty much working every Sunday and I was saving some of the money. So I managed to buy, I think 6 sets of jerseys, football, bits for training. So in May 2016, myself and my team in Ghana donated to the hospitals. So we invited Accra to Pantai. Pantai have got a very big football field. So they all Ankafu drove and their team came to Pantai, and then we had a launch of the project.
Okay.
So
Can I just
decided.
Okay, sorry. I just wanted to pick up on the one of the points you made, because it looks like you started with these workshops and your encounter with NMC. That's what I wanted to pick on, the Nurses and Midwifery Council in Ghana. So you mentioned something about that you maintained your PIN in Ghana when you were nursing in Ghana. Is that correct?
It's correct. So I still maintain it
Yeah.
because one of the requirements is that you have to do training like CPD, continual professional development training. So whatever training I do here, whatever career development I do here, I go to Ghana and then present it and then renew my PIN.
Yeah, I think it's really important that point that I wanted to bring out. It's really because I know some people who've had frustrations because you are lucky you were on the register in Ghana before you traveled to the UK. And so maintaining your PIN probably wouldn't be as hard as somebody who's trained here. And now they have to go and, the NMCs need to write to each other and need to be verified before the person does anything back home. And that in itself can be like a stumbling block for somebody who is eager to go back home and support the healthcare system. And then because of this, they can't do anything. So that's something that we need to note and maybe explore later on. So
yes, I think it's important that we put that one. I mean, these days, most of them are quite flexible with it, in terms of understanding the impact. And so I've got some, I think they are much flexible. I think what referred me to NMC was I was trying to get the foundation from about special risk assessment and management. So, the Pantai NTC is I think Pantai and Ankafu are the NTC that train mental health nurses.
Yeah.
So I wanted to start from the student to build it. By the time they get the wards, then they are kind of tuned with the kind of process. So when I went to the school, then principal actually referred me to the NMC. And that was that issue came up. Yeah. So sometimes you don't get the referrals and you get a very good recommendation from the hospital. They take you on.
Okay. In other words, if you don't get a referral and you are somebody who just goes yourself.
Yeah, I think the interesting part is that the hospitals are more welcoming. If you the administrator, when Dr. Seth was there, you write your proposal to the doctor, and then he look at the content, and then he approve that okay, this will actually benefit the staff. Then he gives you good, then you are fine.
Yeah.
So, but if somebody becomes a bit picky and wanted to be strict on things, he will refer you to the NMC.
Yeah. Because I'm probably dwelling on this because I'm thinking about other people, someone may be watching and thinking, oh, I want to go and do something at a hospital, and I want to, but how do I go about it? And a lot of people have desires, they have ideas, but it's taking the action and knowing who to contact or where to go. That's usually.
I think it's important that I understand the concern that was raised because they don't want to open the doors for every other things. There need to be kind of stringent measures in place to actually manage that. So I think whoever wanted to go, whoever listened to this interview and want to kind of go to Ghana and make an impact, I think you need to make your intention well known, the content, what you want to do, your aim, what the target groups and everything. Make it clear. It's like I normally write a proposal that this is what I want to do. This is a problem I have identified. This is how I want to manage it. These are the contents that I'm going to do. We'll be talking about that, and then it gives them a clear understanding what you want to do.
Yeah.
But if you turn up and say you have this idea, I think there should be prior communication with them.
Yeah.
I give you an example. I went to run a workshop in Ghana and Accra Psychiatric Hospital for the nurses, and then one of the doctors happened to be there, and he said, "This is really important," because he told the audience that this is very important because this is what we were taught at medical school. Mm-hmm. So I added value to what I was trying to do. So I think we need to be more clear, our attention clearly known to whichever organization we want to engage in Ghana. Because what people do is that they just, because here you can't just go to any hospital to say you want to engage with this patient. You need to go through a systematic, a robust system to be approved. The same thing that Ghana is trying to develop. If not, everybody will be coming in and they may not get the value for. So that's, I think, I know the process, but I think people have to make sure they go through the right channel.
Ghana, we now have freedom. Ghana, the land of freedom. Girls of the brave and the sweats of their labor.